It's generally agreed, I think, that human rights include life and liberty, freedom from slavery and torture, freedom of opinion and expression, the right to work and education. Everyone is entitled to these rights without discrimination. So the question tonight is, why should healthcare be included on this list of human rights? And we're going to begin with Senator Rivera.
Good evening, first of all, to everyone, and good evening to you, Susan, Elisabeth, Theo. Congratulations again, and obviously to my cousin, Carlina Rivera. Healthcare is a human right because as a human, you will get sick at some point. You will have health issues in your life at some point, and it should not depend on whether you are wealthy or not if you have access to healthcare, if you have access to coverage. It is that simple. Now, if I always say that if you want that it's like a pair of Yeezys. This is a weird thing, right? Yeezy is a type of shoe. It's an Adidas sports shoe that Kanye West makes. And there's various models that come out at certain times. And if you know the right person, if you have enough money, if you know exactly where to go get it, you will be able to get yourself a pair of Yeezys. Right now, we treat healthcare as if though they were a pair of Yeezys, a commodity which is hard to come by, because it is true that if you are wealthy, you will have access to the best healthcare system in the world right here in the United States. But guess what? The overwhelming majority of people in this country are not, and yet they're human. And so we must move towards a system that provides you access to healthcare simply because you are human.
So, Councilmember Rivera, why do you think that healthcare should be a human right?
It is essentially something that a person, a human being, will need access to. That's exactly right. It is as much a human right as housing, education, food, and I would say a good job is. I was born at Bellevue Hospital, so I know what the benefit of having access to good public health means for families like mine, families who couldn't afford that pair of Yeezys. I think back in my day, they would be like Air Jordans. But when we talk about institutional racism in health, we're not just talking about culturally competent training or education, which is certainly important. We're talking about how we're going to dismantle the societal structures that are meant to discourage people of color and low-income New Yorkers from seeking healthcare. And until we can fundamentally address that anyone should be able to walk in and receive the same kind of quality healthcare services, we're going to be struggling as a city, as a state, and as a nation. And I think it's very, very, one of the easiest things to say is that healthcare is a human right. And it should be something that is not just like a campaign slogan. It should be something that we work towards 100%.
Thank you. So, Theo, Oshiro, why should healthcare be included on this list of human rights?
Well, Susan, I completely agree with my colleagues, esteemed colleagues, on the fact that wealth should not determine whether one is able to live or die. And I would add to that, that how we came into this country should not determine whether we live or die. We've seen that immigrant communities have been some of the most marginalized and the folks that have, in many respects, the hardest time accessing healthcare in our state and our country. And we've seen that they become part of political debates about, whether we should have insurance in this country, free insurance, universal coverage. And immigrant communities are always a piece of that conversation and almost always are left out because it is seen that they are quote unquote illegal. They're not allowed to be here. And so why should they be able to access healthcare? And literally just saying, why should they be allowed to live? We've seen time and time again how much immigrants contribute to our communities, our country, not only to the vibrancy, the cultural vibrancy of our communities, but also economically. But time and time again, we've seen that immigrant communities have been turned away from accessing healthcare. And we know that this means, and as we have seen during the coronavirus and COVID-19, that it's been detrimental. The fact that immigrant communities are not able to access healthcare, are uninsured, has led to tragic consequences in immigrant communities.
Now that we you have gotten the ball rolling. I want to have Elisabeth Benjamin set the table for us. So, Elisabeth, in this country, we do not treat healthcare as a human right. I think we can all agree on that. So, when it comes to health policy, what does the current landscape look like in terms of COVID, the ACA, and the presidential election? I think you're muted.
Unmuted now. Thank you. Well, first of all, I would like to just thank everybody for joining us, and for you, Susan, for being agreeing to be our moderator tonight. It's such an exciting panel, and I can't believe I get to be on a panel with so many. It's like my all-star panel. What can I say? It's really great. I think the COVID pandemic really just laid bare the travesty of our healthcare system and how it is not a human right in the United States, even though, by the way, healthcare is considered a human right under the UN Declaration of Economic and Social Rights. So it is actually in the rest of the world considered a human right. It is just the American exceptionalism that treats it as a commodity, as Senator Rivera says. So, but I think going to the pandemic, I think it really showed how profoundly unfair healthcare and healthcare resources are allocated in the United States and just here in New York. African American, Black people, Latinx people died two times more likely to die than whites in the city, and 4 times more likely to die as whites upstate. That's a problem. In why? And we can just look at what we saw in the photos, right? Elmhurst hospitals, people lined up. Well, why were there so many people lined up outside Elmhurst hospitals in Queens? Well, guess what? There are 4 missing hospitals in that same area of Queens. And why are there 4 missing hospitals? Well, in fact, there's 25,000 missing hospital beds in New York State. In the last 20 years, we went from having 75,000 beds to 55,000 beds or 50,000 beds in New York State. And that is because of 2 major policy decisions. And this is where we talk about what does structural racism look like. This is what it looks like. There were 2 major policy decisions that are really emblematic of why we're missing our 25,000 beds, mostly in communities of color. First of all, we deregulated how hospitals were paid. It used to be there was a fair allocation of payments and there was a hospital rate setting process that ensured that we had a robust, well-funded healthcare system, regardless of where you lived. The second thing that we did is we deregulated all the health planning. So now, instead of having local health systems agencies making health planning decisions, every hospital is allowed to shut down or open beds or do basically what it wants. If there is a panel at the state level that supposedly reviews these things, but guess what? Who's on that panel? The private and voluntary hospitals. So it's sort of like, a very kind of quintessential, the foxes are guarding the hen house. And they have approved all these shutdowns and all of this, continue to increase, sort of this nuclear arms race, if you will. For example, North Shore trying to build a 40-story tower at 79th Street when we don't have enough hospitals in Queens. Why should that be allowed? Well, it's being allowed because North Shore wants to have a trophy on the Upper East Side of Manhattan. And we really have to look at that. So the other thing that's been really horrible to see in the COVID pandemic is that the federal health policies have just further exacerbated these disparities. So on a county basis, we have 6.4 beds per 1,000 people in Manhattan, and we have 1.5 beds per 1,000 people in Queens. In Manhattan, the federal funds provided $662,000 per COVID death. In Queens, they got $126,000. So basically, per case, if you do it by case, Manhattan got 10 times more COVID funding than Queens for its providers. So that continues to exacerbate the structural unfairness in our healthcare delivery system. And that is what further, kind of undermines any hope for us having health as a human right in New York State. Pivoting quickly to the ACA, or should I stop?
No, keep going.
Another big threat to all of this is the fact that the Supreme Court is going to hear the ACA, the case about the Affordable Care Act, or what we call Obamacare, again. And this is a case that's been brought by, now it's left to like just 13 states who I think are plaintiffs. But unfortunately, the Trump administration has joined with those states. So it's the blue states like New York that are left to defend this case before the Supreme Court. And basically what they're saying is, under the Republican tax bill, they got rid of the federal tax penalty to enforce the individual mandate, which means that everybody's supposed to have health care coverage. And in exchange for that, there's the insurance companies are not allowed to discriminate against us. And so they can't pick and choose who they're going to provide coverage through to. Like in the olden days, they used to do that. You're a woman, no coverage, you might get pregnant. You've had a baby through a C-section, no coverage. You know, we don't want to cover you. You've had cancer, no coverage. Like, so we used to have this, discrimination that was allowed under the Affordable Care, before the Affordable Care Act. And the Affordable Care Act got rid of that by having this individual mandate. Now, the Trump administration is trying to get their fifth justice confirmed. If they do, they basically have the votes to strike down the Affordable Care Act. Are they likely to strike down the whole Affordable Care Act? They can. That's what the states are asking for, and the Trump administration isn't saying no, don't do that. So that one horrible worst case outcome is that they just strike down the Affordable Care Act. Obamacare's over. The 2 million people that got health insurance in New York State will no longer have a federal Medicaid expansion paid for, will no longer have subsidies and financial assistance. I mean, who knows what will happen. Hopefully they won't do that. Hopefully they'll just say, oh, we're just going to say that the individual mandate and the pre-existing condition that's tied to it, VAR, we're going to strike that down, but the rest of the law stands. Seniors will still be able to, get drugs without having to go back to the old donut hole. Young people will still be able to stay on their parents' health insurance. Like all the other benefits of the Affordable Care Act will stay standing. That would be not a horrible outcome, right? We would be thrilled to have that if that's what they did. The third thing that could happen is, we are not partisan, but the fact is if, Vice President Biden becomes President Biden and the U.S. Senate and the U.S. House stays Democrat and the U.S. Senate flips to Democrat, they could cure this and make the whole case go away by saying, okay, there's going to be a $5 tax penalty for the individual mandate. And then the whole case goes away. So these are scary times. And healthcare is clearly not a human right in America right now, but that's why we live to fight and we will continue to be in this struggle.